They won't tell you this at your regular doctor's visit. But let me be blunt. If you've stopped masturbating as you've gotten older, your body might already be suffering, and you probably don't even realize it. No, this isn't locker room gossip or some taboo topic. This is real clinical truth. Ignoring it can affect your sexual health, your brain, your heart, your sleep, your immune system, and even your sense of self. I'm Dr. Nora Hayes, a urologist and men's health specialist with 7 years of experience helping aging patients maintain vitality, independence, and confidence. Over the years, one silent problem keeps coming up. Many older adults give up their sexual health entirely, and with it, a key to overall well-being. Here's what may surprise you. Masturbation isn't just leftover impulse from your youth. It's one of the most powerful tools your body has to regulate hormones, boost brain function, protect the prostate, fight depression, and even improve sleep. If you've stopped or never started, the consequences might be higher than you think. In the next few minutes, I'm going to show you exactly what happens inside your body when you give up self-intimacy in later life and how a few simple habits can reclaim your health and confidence. Before we dive in, if you care about staying sharp, strong, and independent as you age, go ahead and subscribe and hit the bell so you never miss advice tailored just for you. And if this resonates, type 1 in the comments. I'd love to know you're here. 1. Decreased prostate health and urinary function. Let's start with the most overlooked consequence. What happens to your prostate when you stop masturbating? I remember a man in his early 70s, sharp and fit, who told me, "Doc, I just figured I didn't need that part of life anymore." But he'd been waking up 4 or 5 times a night just to pee, and he didn't understand why. Here's the truth. Regular ejaculation, even solo, keeps the prostate healthy. The prostate isn't a passive gland. It produces fluid, expands and contracts, and relies on activity. Without stimulation, fluid stagnates. This can cause swelling, inflammation, and pressure that disrupts urination and sexual performance. You might notice a heavier bladder, weaker stream, or discomfort that never fully goes away. Ignoring this can lead to benign prostatic hyperplasia, BPH, which affects nearly half of men over 60, and in some cases, bladder infections or the need for catheterization. One patient I worked with eventually required surgery to relieve pressure, a problem that might have been prevented with regular self-stimulation. Studies even show that men who ejaculate 21 plus times per month have a significantly lower risk of prostate cancer. Remember, this isn't about returning to youth. It's about function, dignity, and keeping control of one of your most basic bodily systems. 2. Cognitive fog and reduced mental clarity. Next, let's talk about your brain. A man in his late 60s once told me, "Doc, I don't feel like myself anymore. I walk into a room and forget why I'm there. I lose my train of thought." Sexual activity, including masturbation, releases dopamine, serotonin, and oxytocin, chemicals that support memory, focus, and emotional regulation. Regular stimulation also improves blood flow to the brain and lowers cortisol, the stress hormone that damages brain cells in high amounts. Stop self-stimulation, and these chemical surges become less frequent. Over time, mental clarity dims. You may forget names, dates, or lose motivation. In some cases, reduced sexual activity correlates with early cognitive decline. This isn't a sudden change. It's gradual, but avoidable. Reconnecting with your body wakes up your brain, preserves mental sharpness, and protects your sense of identity. 3. Heightened depression and emotional numbness. The emotional impact is equally important. I once treated a widower in his early 70s who said, "I don't feel anything anymore. Not sadness, not joy, just flat." Masturbation isn't just physical, it's emotional release. Orgasm triggers oxytocin and endorphins, your body's built-in mood stabilizers. Remove this, and loneliness, stress, or grief can slowly turn into emotional numbness or depression. I've seen patients regain vitality simply by reclaiming self-intimacy. One man told me, "It reminded me I was still human, not just a body waiting to shut down." 4. Poorer sleep quality. Sleep suffers too. A patient in his late 60s complained about waking up at 2 a.m., restless and frustrated. Tests were fine, but when I asked about his intimate life, he admitted it had stopped. Orgasm triggers a cocktail of oxytocin, prolactin, and endorphins, chemicals that shift your nervous system from stress to rest. Without it, your sleep fragments. Over time, this leads to fatigue, cognitive decline, immune weakness, and even increased fall risk. One patient said, "I sleep like I did 30 years ago after reconnecting with this part of myself." Sometimes a small act of self-care is the missing key to restorative sleep. 5. Weakened pelvic floor and circulation. Regular sexual activity also keeps your pelvic floor muscles active. These muscles support your bladder, bowel, and sexual organs. Without stimulation, muscles atrophy, blood flow decreases, and nerve signaling weakens. The result? Urinary leakage, difficulty standing, or discomfort. For men, it can reduce sexual function. For women, dryness or tension can make intimacy uncomfortable. Ignoring this isn't just inconvenient, it threatens independence and dignity. Reconnecting with your body strengthens circulation, keeps tissues healthy, and maintains functional control. 6. Lower immune function. Did you know self-intimacy can boost your immune system? During orgasm, immunoglobulin A, IgA rises, a key antibody defending against infections. Endorphins reduce inflammation, aiding healing. Stop sexual activity and your natural immune boost disappears, leaving your body slower to fight illness. Older adults who neglect this often get sick more frequently or recover more slowly. Even solo stimulation sends signals that your body is alive, active, and ready to thrive. 7. Loss of body ownership and self-worth. Finally, neglecting self-intimacy can erode your sense of self. A retired principal in his late 70s told me, "I don't really feel like I live in this body anymore." He had stopped touching himself and slowly disconnected from his own body. Self-touch isn't just pleasure, it's presence. It signals to your nervous system, "I'm here, I matter, my body matters." Without it, emotional distance forms, and motivation for basic self-care fades. Reclaiming intimacy restores dignity, identity, and a sense of life's richness. Aging isn't about disappearing, it's about choosing to stay present in your body and life. So what can you do? Start small, reintroduce self-intimacy gently without pressure. Even brief sessions are beneficial. Consistency over intensity. Regularity matters more than duration. Mind-body connection. Focus on awareness of sensations, not just the act itself. Integrate pelvic floor exercises. Strengthens muscles for bladder control and circulation. Monitor sleep, mood, and energy. Track changes as you reconnect with your body. Remember, this isn't about shame or fantasy. It's about health, dignity, and vitality. You are not broken. You are not past your prime. Age does not mean giving up your body, your pleasure, or your self-worth. Every small step you take to reconnect with your body protects your mind, your heart, and your independence. Even modest changes can restore confidence, freedom, and joy in ways you might have thought were lost forever. If this message resonated like this video, share it with someone who might need it and comment below. Where are you watching from? Your voice might help someone feel seen. Remember, reclaiming intimacy isn't indulgence, it's care. It's your body telling you it's still alive, still capable, still deserving. Small changes today can bring comfort, freedom, and confidence tomorrow. You deserve to feel alive, connected, and whole. At 70, 80, or beyond, start now. Your body and your life will thank you.